You're listening to The Washington Report. Here's Stevie Bridgewaters.
Good morning, everyone, and thank you for joining me here today on The Washington Report. It's February, and we are going to go red. And what does that mean? We're going red to raise awareness about heart disease, the number one killer and the condition that kills more women than any form of cancer and all cancers combined. On the show today, I'm having Dr. Virginia Hahn. She's with Johns Hopkins Medicine, and one of her patients, Andrea Wongsam. So thank you, Andrea Wongsam. I've been having trouble with names and words today, so thank you both for joining me here today on the Washington Report.
Good morning. So glad to be here.
I am so glad to have you both. And before we got connected, Andrea, can you please share with our listeners what you said about Dr. Hahn?
Oh, Dr. Hahn is my most favorite person in the world. That's it. I just can't say enough about Dr. Hahn.
And so why is that? Let's lean into your journey as we begin this interview.
Yeah, Dr. Hahn is, the head of my care team. I am a heart attack survivor. I had a heart attack 20 years ago. I was 35 and 13 weeks pregnant, and a first-time mom-to-be. And I was having a good pregnancy, just not a pleasant one. I had, every day heartburn, nausea, vomiting, fatigue. Several times I had to go to the urgent care. They'd send me to the hospital to get rehydrated. I'd feel better, go home. The morning of my heart attack, I had a long commute to work. I lived in Frederick, and I worked at the NIH. And soon after starting my day, my morning sickness intensified. It just started to get really, really bad. My heartburn was really burning. My nausea had intensified. I was very hot. I tried to fan using my left arm, and I couldn't. I felt like my jaws were clenching. And in my head, I was like, well, my morning sickness had just gone haywire that day. And I kept thinking to myself, if I could just get a minute to collect myself, I'd feel better. I decided to go to my car. I found it very hard to walk in my heels. I had to take my shoes off. I walked in my bare feet. Into my car, I peeled off a layer of clothes. I rolled the windows down halfway because I was so hot. And I have to tell you, it was March 15th here in D.C. It's rarely hot on March 15th in D.C.
Right.
And I just could not find a comfortable position. No position was comfortable. The burning in my chest was now radiating to my shoulders. My arm was limp. My jaw was tight. I had this screaming headache, and I just kept thinking, gosh, my morning sickness is so aggressive today. All those thoughts of baby that I was having earlier in the morning on that long commute, those were all, drifting to the side at this point. I just couldn't get myself together. So I decided I'm going to drive myself to the ER. I've done this before. I'm just going to go to the ER, and they're going to to the urgent care. They're going to send me over to the emergency room. I'll get well again and go home. I got to the urgent care. The doctor, they did an EKG. The doctor came in, and I distinctly remember him looking at me looking at him, and him saying, "You're having a heart attack." And I said to him, "That's impossible. I'm just a pregnant woman who was at work earlier today." Shortly after that, I was being shoved, or not shoved, I was being loaded into the belly of a medevac. And I arrived at Hopkins, and I have to tell you, it was this well-orchestrated chaos. I was able to have emergency surgery, and I would later spend 10 days in the coronary care intensive care unit there. So in one morning, I managed to have a heart attack, need to be airlifted, have emergency surgery, earn myself 10 days in the CCU at Hopkins, but most importantly, I lost the baby. And how did I allow this to happen? That night when it was quiet and I had a chance to reflect on the day's events, I realized that I just didn't know what the signs or symptoms of a heart attack were. I missed all the classic signs. It was never my morning sickness. And I missed it all because I'd never taken the time to learn what those signs of a heart attack were, and never I'd never taken the time to learn about women's heart health. I will admit, though, that I had a couple blind spots that day, and those were that I was young, I was healthy, I was pregnant, and I was having morning sickness. And those things truly grounded me in the belief that it was my morning sickness. But, my biggest blind spot was that I didn't know some of the classic signs of a heart attack. The fallout to that was that, shortly after that, I had to have a defibrillator implanted because I was at risk for sudden cardiac death. My heart functionality was still quite poor. And I also had to have my tubes tied because now pregnancy was off the table for me.
Wow.
So
wow.
I know. I stepped into my physical and mental journey back to wellness. My primary focus was on the physical because I knew that if I hit all those milestones, right, if you increase your physical activity and you adjust your nutrition and you have these great relationships with your care team and you keep your appointments and you take your medicine as scheduled, it's going to keep you alive, right? And I focused so much on the physical that I totally neglected my mental wellness, and I had layers and layers of deep trauma. I was living in darkness for a really long time in a house created by a very unfortunate event, a house of loss and grief and guilt and devastation. And I have to give credit to my incredible family, my support team, my care teams, and all the shoulders that I stood on to see light. The truth is they were never going to be enough to get me out of that darkness. I needed a couple things.
Wow.
I needed professional help, yeah. But I also needed a place where there were women like me, right? A place where there were similar stories, where someone understood my triggers, when someone understood my levels of anxiety and when I felt anything, between my belly button and my neck,
right.
What it felt like to prepare for another heart surgery, what it felt like to get that call from your care team that gutted you. I needed that place, and then I found Go Red for Women. And I have to tell you, I had landed on my planet.
Wow.
I had landed on my planet. It was a space just for women. I've been a spokesperson for Go Red for Women for 15 years. And I have to tell you that nothing thrills me more than being able to share this story, to raise awareness and to educate and be an advocate for women's heart health, because I fully understand how small pieces of information can be life-changing. So here we are. We are living out loud with Go Red for Women, and it's going to be Wear Red Day, and we're just loving all of it.
Oh,
and
wow.
That's my story.
Wow. I'm almost speechless. Hearing, you've got me wrapped up here. Let me collect myself. So that leads me to you, Dr. Hahn. In all fairness, she was young. Are we seeing this happen more and more with our young women, that they are facing heart complications at younger ages? Is this an anomaly? What are we looking at today here in 2025?
Yes, thank you so much, Andrea, for sharing that story. Andrea really turned a horrible event in her life into something positive, where she is, really advocating for other women and patients in general to really know the signs of a heart attack and listen to their bodies. I think one big misconception is that heart attacks are due to cholesterol plaque buildup in the arteries, and only that. And Andrea was a great example that heart attacks can be caused by other things. And oftentimes the other things that cause heart attacks don't have the same sort of risk factors, like unhealthy diet, advanced age, smoking, inactivity. And her story also highlights that pregnancy is a particularly vulnerable time for women because of sometimes having to come off of medications that were controlling other conditions. And also it can cause issues with the coronary arteries themselves that can cause a heart attack. people are more prone, or women are more prone to blood clots during pregnancy and in the postpartum period. And then the heart has to pump a lot more blood during the pregnancy to the placenta and the fetus. So it is a vulnerable time for women who are often otherwise healthy. We are, in general, in the United States, seeing more cardiometabolic disease, particularly with the obesity epidemic. And this is putting women and men at risk of heart disease at younger ages. But we always have to keep in mind these other forms of heart attacks that can affect young, healthy people.
I'm floored right now. I didn't expect to hear such a story, to tell you the honest truth. And I'm just having a moment to reflect back when I was pregnant, many, many years ago. My boys are, I'm blessed to have two of them, the older and in their 30s, but I never heard about heart health when I was pregnant. And I just, hearing this story and hearing how you're describing it, is that a question that our young moms need to be asking their physicians? And is it something, how can they persist to make sure that they are still staying healthy during their pregnancy? Heart healthy, I should say.
It's a great question. So absolutely. I think often young people think that we can sort of wait and worry about our heart health later because we're fine now. And we know that lifestyle has such a huge impact on our heart health. What happened to Andrea is something different that's not related to lifestyle risk factors. So that's important to understand, that you can have an A++ grade on your diet and exercise and sleep, and these things can still happen. So number one, you have to listen to your body, and know that if you feel something is not right, keep advocating for yourself, because even young women who walk into the emergency department, we already have some bias that, they're not going to have these other conditions that happen in older people with risk factors.
Right.
But like Andrea was saying, there is a lot that we can do from a lifestyle standpoint to lower our risk as much as possible. And this does include preparing for pregnancy and taking care of ourselves during pregnancy. I like to use the American Heart Association now has something called Life's Essential 8. And it includes, first is diet, second is managing weight. And we know that, obviously during pregnancy, it's a period of weight gain, but making sure that going into pregnancy, risk factors are under control, we're at a healthy weight, and that there isn't excessive weight gain during the pregnancy. Third is physical activity. So we're supposed to do 150 minutes of moderate activity or 75 of vigorous activity every week. And this is very difficult to do when you are young and your career is hot and you have other obligations with family.
Right.
It's really difficult to fit it in, and I live this myself. The fourth one is controlling cholesterol, so really knowing your cholesterol and your risk factors. Oftentimes, high cholesterol disorders can be genetic. So again, you can look at somebody who looks very young and healthy, but they may have something that they inherited from their family. The fifth one is smoking. So obviously pushing ourselves to quit smoking. That includes e-cigarettes and vaping. The sixth one is managing blood sugar. And this is something that all women get tested for during pregnancy for gestational diabetes.
Right.
And And then the 7th is getting healthy sleep. That's a common one that we skimp on when we are young and we can get away with it.
Right.
Mm-hmm.
Right. Wow.
And the last one is managing blood pressure. So just there's lots of lifestyle things that we can work on. And I find young people, we tend to think, oh, we'll worry about that later. And then the second point is you can do your best with lifestyle, but there are some just unlucky things that can happen. And that's when we need to educate about the symptoms of a heart attack and just that understanding that it's not just cholesterol plaque buildup that can cause it.
Right. I really appreciate you saying this, and it's something that our listeners really need to take heed, and to include myself. Stress was one of my bigger things, and ending up in an ER, just like unable to control myself, and blood pressure off the roof and the whole nine. It's like, well, it's just stress. But then the symptoms keep coming, and here's your EKG. Your EKG looks normal, but I don't feel normal. So let's do a stress test, and then we'll measure and see. Is there a such thing as going beyond a stress test and actually asking for a sonogram to see if there's any blockage? I mean, or is there, what can a person do? Beyond the normal steps, if you will. Dr. Hahn?
It's a great question. There are other tests beyond a stress test that are the gold standard for diagnosing any problem with the coronary arteries. However, this is really something that has to be between the patient and their physician, because each of these scenarios is very different.
Right.
As we get to the more invasive tests have complications associated with them. So we are very careful about making sure that we order the correct test. I think I really, really try to avoid blaming things on stress because that is the absolute last diagnosis that we should consider. We should always consider the other things first. And so I think as a patient, really just if you feel that something's wrong in your body, really just advocating for yourself and saying, something is off. This is not normal for me.
Right.
And the great thing about cardiology that I love is that we do have great tests. And so we are able to get to the bottom of these symptoms most of the time.
Wonderful. All right, Andrea, we were talking about going red. What does that mean?
Ma'am.
I know what the color red looks like. So what does that mean? What does it mean to go red?
Oh, my goodness. Wear red day and to go red. Well, our number one killer is cardiovascular disease, right? But wearing red, we're going to wear red on February 7th because we do want to be seen. We want to be seen. We want to be counted. We want to be heard. We want to make an impact. So women of every age, stage, and season of life need support as we take on our greatest health threat, which is cardiovascular disease. We know that cardiovascular disease unfairly targets women, but fortunately, we have the most amazing resource, and that's each other. So we're going to go red. Going red, millions of people across the nation will come together and rock red with us.
Right.
It's a day that we raise awareness for our nation's number one health threat, which is cardiovascular disease.
Now, are there any local organizations that you have worked with, Andrea, to help support women who have heart disease or maybe have a family member who's going through any kind of struggle at this time?
Well, my local organization is the Heart Association of Greater Washington Region. Yes, and you can follow them on Instagram at Heart of GWR, which is short for Greater Washington Region, and that's who I do all my events, all my things with is Heart Association of Greater Washington Region.
I love it. And so with that journey, Andrea, it's how easy is it? I know I'm trying to formulate this question. How easy is it for you to reach out to young women? Are they listening?
I speak to, whenever I speak or whenever I have an event, I meet people of all ages that have been touched by cardiovascular disease in some way or another. They're either a survivor, a caregiver, somebody that has had a stroke. So, I'll speak to anyone, but young folk in particular, it just depends on the group that I speak to. I'll speak to anyone.
Well, I'm glad you're speaking to me today.
Well, Stevie, I do want you to feel better about my story. It has a beautiful ending.
Yes.
I don't any longer live in that dark house. I live in one that I've created with the help of the American Heart Association and my amazing care teams. And, this one, I'd like to call it is having a bright future. And it was built on bravery and resilience and strength and self-love and whole wellness, but also built on the courage to be vulnerable enough to share a very personal story, but also built because of a purpose. So that is the beautiful ending. So
yes,
please feel better.
Yes, I feel better, but I'm one of those empaths, and so I'm visualizing everything that you're saying, and I immediately have this I just want to hold you reaction, or, it's just, and I'm pretty sure I'm not alone with that. But the good part is that we can talk about this, and you're here to talk about it. And so for this year's Heart Month, you're highlighting, of course, women's heart health, congenital heart defect survivors, and the women and teen of impact campaigns. So, yes. And so, Dr. Hahn, how is it that our teens are a part of this conversation?
When I met Valentine Fuster, who's one of our leading cardiologists in our communities, he was actually advocating that we should start heart health education in preschool.
Wow. Yes.
Because you really want, there's a concept of prevention of cardiovascular disease, and then there is a concept that we'd actually like to prevent the risk factors of cardiovascular disease, which is called primordial prevention. And to prevent the risk factors, you have to start very early when before the risk factors develop. So in teens now, there's sort of extremes. There's extreme involvement in athletics and extreme focus on being healthy. And then we have less participation in sort of recreational level sports. And that decline in physical activity and more time spent on devices is not just unhealthy for our physical selves, but we have more and more data that it's unhealthy for our mental well-being as well. So for teens, the challenge with teens is that they're not really thinking about preventing things that'll happen to their grandparents. So we have to really make it about something that, something tangible to them, and really just having that education and that understanding that, like, these healthy habits are not just about preventing something that may or may not happen a long time later, but you actually will feel better in the here and now if you are sleeping well, eating well, moving your body, avoiding substances that are toxic. And that actually helps our mental well-being as well. Stevie, you talked about the role of stress. Stress also plays a role in cardiovascular disease, and I've never met a person who is able to eliminate stress from their lives. It's part of the human condition, but having these tools to manage it help us so that the stress doesn't have like physical manifestations in our body.
Right.
So I think teens, really, it needs to be more time doing physical activity, less time on devices, manage stress management, and then some focus on nutrition to help them feel better in the here and now.
Awesome. I have to say that my biggest stress is no longer in my life. I'm no longer a preschool director, but I have to say I agree with you 1,000% when you say start in preschool, because I know that during the month of February, it is all about heart health. Sure, it's about Valentine's and the candy and all that, but we actually took a time frame and did a block on heart health with our younger ones and even our 3-year-olds. You take blue yarn and red yarn. You can show them the difference between a vein and an artery and how the heart is so strong and it keeps your body moving. And you need your heart to live. And how can you keep your heart healthy? By eating healthy things. So that campaign, absolutely, I'm on board, and the children will absorb it and they'll have fun with it. And then maybe they'll start to worry about their grandparents when they become teenagers. That's the goal.
Right. I mean, teenagers, it's tough to start there, but if you start with the school age kids they are so literal, and they just believe what you're saying. And so if you say this is healthy, this is not healthy, they then can actually become advocates within their own families. So I do think starting younger is great, because they also, I think, love to become the educator of the family. And
it's a perfect place to start. Well, I'm really coming against the clock here, ladies. I've had such a great time speaking with both of you. Dr. Hahn, what is it that you would like to share with our listeners, website or anything like that, where they can go to learn more about their heart health?
So I recommend Googling American Heart Association Life's Essential 8, and really start there, and then just really knowing the signs and symptoms of heart attack and stroke. If we could have every woman in the world know what the signs and symptoms are, and then also what tools they have for prevention, we would make a lot of progress.
And for you, Andrea, what would you like to share with our listeners as we start to wrap up?
Well, I'm big on Wear Red Day. I love a good Wear Red Day. So start snapping those pics and hashtag Go Red DC or hashtag Wear Red Day. But certainly, as Dr. Hahn has been explaining, it is so very important. It is vital to, for everyone to know something about your heart health. I didn't, and, at least I'm still here to share a story, but really it is so important. So we want to use Wear Red Day to raise awareness and let everybody know heart disease is your number one health threat.
There you go. Thank you, ladies, very, very much for joining me here today on the Washington Report. I've been speaking with Dr. Virginia Hahn with Johns Hopkins Medicine, and she's Andrea's Wongsam's cardiologist. And ladies, thank you very much. Happy living, healthy living.
Thank you. Thank you so much for having me.
Think Harrington.